How to examine your own testicles in a minute. The month of April is Testicular Cancer Awareness Month. And though testicular cancer is a rare form of cancer, it is slowly rising among young men. The most common cancer found in young men between the ages of 15 to 35 years, although it can still occur in older men. If it is caught earlier, it can be treated. So in this video, I'm going to show you how you should check your own testicles. You should do this every month from the start of puberty as a man or as a boy. The position or location of the testicles is very delicate and you might feel nervous about it, but it's important that I bring you this helpful demonstration to run you through how you can self-examine your own testicles, what to look out for, some signs and symptoms, some facts about testicular cancer, and when you need to be worried so you can see your doctor. This can really be an effective way to get to know this part of your body to potentially detect testicular cancer and seek early treatment. Hi, I'm Dr.RAYLEE. Welcome to my channel. If you are new, make sure you subscribe and hit that bell and give us a thumbs up by tapping that like icon because it's definitely going to get value out of this video. Our testicles, I believe that part is the most or the weakest part of a man's body. And oftentimes it is not talked about much, but it is important we get to know all the parts of our testicles and what they do, the importance of the testicles as well. So I'm going to use these two eggs as your testicles. And to examine your own testicles, it is best performed after a warm shower. This will relax the scrotum, that is the sac of skin that supports the testicles or contains the testicles. It will make it easier to spot anything that is abnormal. So anytime you want to check or self-examine your own testicles as a man, please take a warm shower first before you do that. Also, it is best performed standing. Now, imagine these are your testicles as a man, and usually one is normally bigger than the other, and also one is a bit lower, okay, than the other when you are standing, and it is perfectly normal. When you see one being lower than the other, don't think something is wrong with your testicles. It's perfectly normal. And we are going to examine one testicle at a time. So we're going to focus on one testicle and then we move on to the next one. Okay, so what you do after taking a warm shower is you're going to take your thumb, okay, and your forefinger and use the other hand to hold the testicles just like this. So your thumb and your forefinger or index finger, and you place your thumb, okay, and the forefinger on the sides of the testicle, feeling from any lump from top to bottom, okay. So right here, you check right here, you go from top to bottom, and the sideways, you move from the sideways, you do that, okay, feeling for any lumps or bumps or changes in size or shape of the thumb of the testicles, okay. So you just go like this, you feel for it, you do that, you move, you make sure you want to work your way around the whole testicles just to make sure there aren't any lumps at all. So let's go again from top to bottom, you feel for any lump, okay, move to the sides, make sure you do that to feel for any lumps or bumps, okay, and it's pretty much simple. And once you are done with one side, you move to the other testicle and repeat the same pattern. If you feel for any lump that is greedy or you're not able to pull them off or move them off the testicles, it might be a sign that you want to get checked out. And also be sure to check the back of the testicle, okay, to familiarize yourself with the epididymis, which is a soft coil tube-like structure that collects and carries sperms to the vas deferens, so you don't mistake it with a suspicious lump. It is a normal finding. It is at the back of the testicles. Please know that. That's why it is important we get to know the anatomy of the testicle as shown in the video right now. Now, it is important to know that there are two types of testicular cancer. They are one seminoma and then non-seminoma. and this develops in the testicles, mostly commonly starting as a lump or swelling that may or may not be painful. Also, other symptoms and signs you might experience aside the lumps or the bumps would be a testicle that gets bigger or feels heavier, a dull ache or pain in the lower abdomen or groin, a sudden build-up of fluid in the scrotum, pain or discomfort in a testicle or scrotum that is not going away, and then significant loss of size in one of the testicles. Also, who are those likely to develop testicular cancer among men? That is from 50 to 35 or even above, because it is important we get to know some risk factors of testicular cancer. And the first or the most common one would be undescended testicle, called cryptorchidism. Also, abnormal testicle development, a personal or family history of testicular cancer, being a young or middle-aged man, mostly between the ages of 15 to 35 years, and even HIV infections. HIV infection can potentially increase a man's risk of getting testicular cancer. Please note that it is super important. Now, what should you do when you find any abnormality with your testicles? Simple. You should make an appointment to see your doctor for further examination and test. And sometimes most swellings or lumps in the scrotum are non-cancerous, because there are also non-cancerous conditions that may cause similar symptoms to testicular cancer, such as varicocele, a cyst, or even hydrocele. However, you should always see your doctor if you discover any swelling or lump in your testicles and other symptoms and signs we've talked about as soon as possible. So this is how you can check your testicles. It's simple, just within a minute, and the other facts about testicular cancer. And if you are watching and you're a man, kindly start checking your testicles right now every month. And do share this video with all your loved ones, especially the men. If you're a woman who are watching, please share this video with your fathers, your brothers, your sons, your male colleagues, and all your loved ones, so we can save a life. Because remember, if it is detected earlier, we can treat it successfully. Thanks for watching, and I will see you in the next video. Your health, your life. God bless you.